Hello again, everyone, and welcome. Thank you so much for being here today. My name is Logan Davis, and we will be doing a live ScreenU demo today. Very excited to take everyone through the ins and outs. I have the pleasure of working at the Higher Education Center as the Outreach and Engagement Manager. Just have a couple of housekeeping slides today. It'll be mostly me today. We do have my colleague Anthony Gonzalez in the background today. So if you have any questions or needs, feel free to reach out in the chat and he can help you with whatever you may need. So in terms of housekeeping, a couple things to go through is our standard slides here. If you need help with the audio settings in the bottom left hand of your Zoom toolbar, and then we will be collecting questions in this. Please feel free, excuse me, to ask them throughout. Please use the Q&A feature so we can make sure to keep track of all of those questions and don't want them to get lost in the chat just in case. So please put questions there. I do want to highlight briefly just our membership model. The center is a membership-based center, and so ScreenU is included in that membership. So we'll be going through ScreenU, which is in the top 2 levels of membership, and then we also have education-only memberships that do not include access to ScreenU. But we try to do as much free stuff as we possibly can. So a couple of events. One of those free events that we do each month is a water cooler chat, informal conversation with folks across the country. And we're going to be having Jill Maurer and Susie Bruce from the Gordy Center joining us on June the 10th at 2 p.m. Eastern Time, talking about the Stop Campus Hazing Act. So leading folks in a conversation about that. And the date is not finalized for a July webinar yet, but Jill from the Gordy Center and some folks from Stop Hazing are going to be joining us for a webinar conversation on the Stop Campus Hazing Act as well. And then would be remiss if I didn't mention the national meeting coming up. Please come hang out with us in Columbus, Ohio, October the 21st to the 23rd. If your campus has said no, no, no on traveling, then we will allow you to hang out with us virtually, as we will be hosting a simultaneous virtual event. And if you would like to have input on the training and the opportunities provided by the Higher Education Center, we are currently accepting applications for our training advisory committee that runs through June the 6th. So that is all of the housekeeping slides. I just want to give you an orientation. We are going to go through a few slides to set the tone on screening. So doing a brief overview there. And then we will get into the ScreenU demo itself. So Anthony, thank you so much for sharing those slides. As I start to get into the screening, the brief overview of screening, I would love in the chat if you could do 2 things for me. If you could introduce yourself briefly and just tell us who you are and where you're from, but also if you have a specific aspect of ScreenU that you would like to see in the demo today. I want to make sure I'm covering everything that people came for. So if there's something specific that you want to see or want me to cover, please include that in the chat as well. Okay, so first off, I want us to think about screening, but from a broad perspective. If we're screening for something, most of the time we're looking for certain things. This could often be in like providing feedback or collecting feedback. We're trying to detect things. And so we do screening all the time. One way we do screening, we may not think about it, is when we're selecting fruit. I don't live in the same city as many of you, but I'm sure many of you I could be seen at the grocery store selecting strawberries, for example, and picking up the package. You're screening to make sure that they look okay, probably not all ripe just yet, making sure there's no soft or bruising on there. This could be the same with oranges or apples. That is a type of screening. Another type of screening, going away from food, is dating. Trying to figure out, are you screening? Does the person, do you vibe well? One of our close family friends is on the dating search using dating apps. And when I think about the components of screening, that's exactly what she do. She has a checklist, a screening list, if you will, for every single person that she matches with, right? So that is a form um, of screening. And then so if we think about ourselves, we screen every single day. Do we do the appearance? Are we doing every single thing that we want to do to meet our demands, our daily checklist, if you will? Searching for a car is a screening list that we go through. And then so if a family is searching for a car that has small children, they're going to have requirements. They're going to have a screening list. While car number one in our 1, 2, 3 of cars is probably really fun and really fast, it might not meet the needs on that screening list of a family car. And then when we think about screening in more of a context that we use it for, in that kind of public health setting, is we're looking for that early detection. And so screening just isn't used in substance use. It's used all throughout kind of public health. So we think about taking someone's pulse. I'm thinking about an oxygen reader on someone's finger, seeing if something is off baseline. It does something kind of pop off the page, if you will. And so we're going to walk through components of screening with just the basic W's and H question. And then so the first is really, what is screening? And we'll do so from the lens of SBIRT, which stands for screening, brief intervention, and referral to treatment. In many ways, it's the gold standard of screening. And so supported by the World Health Organization, and really just that step by step, go through the screening, talking through those results, providing feedback, doing a brief intervention if needed, and talking about resources or treatment if necessary. And SBIRT isn't just with think substances, it can be mental health or other types of screening as well. And so some things to know about SBIRT is that it quickly assesses the severity of use. Quick being the key here in our settings. We're thinking about higher education setting. It's quick. Can be done in person in less than 30 minutes, or the screening itself can take place in less than 10, excuse me. Focus on increasing insight and awareness. So letting them know, like, hey, here's an insight into your use and what is happening because of that. Provide appropriate resources and care. So letting someone know about your drinking at this level, or you're consuming or using cannabis at this level. Or if we're thinking about a mental health capacity, because it can also be used there, you're probably experiencing, or you're showing signs of this, you might be experiencing these things. And then so if you would like to seek care, here's what to look for, here's appropriate resources, and then so you can provide that based on the information given in the screening. And again, it's an early intervention approach aiming to prevent more severe consequences from occurring. And then so we're trying to prevent greater use. We're trying to keep people at a lower risk level. So just reiterating what we have already gone over, just key components of screening and SBIRT, the brief component. So that brief intervention, but the screening itself is brief. Overall brief, it's universal. It can be done in a variety of settings. It doesn't just have to be done in that healthcare triage setting. It can be done anywhere and everywhere. It could be done kind of in masse. It could be done as a check-in procedure anywhere that you have a check-in process. And so the goal is ultimately universal and can be done outside of those treatment centers. And it utilizes motivational interviewing. So that brief intervention process in the middle is informed and categorized by motivational interviewing. So why? So we figured out a baseline of what screening is. So why screening? Why SBIRT? So research has been known to show that it reduces typical BAC and peak BAC. And then so students going through SBIRT, participating in that process, getting their feedback, having that conversation around a brief intervention has shown that it reduces those 2 points of BAC, peak number of drinks per setting, average number of drinks per week, number of drunk episodes, and overall reduction in substance misuse, including cannabis frequency. Now, majority of the research that is out there has been done on alcohol, but there is an increased amount of research coming out on cannabis as well. And then so previously, before COVID, there was a meta-analysis of 185 studies. It found that the beneficial outcomes partnered with the savings that you have in resources from implementing brief alcohol interventions, from adolescents and young adults made SBIRT a worthwhile prevention strategy. So looking at a meta-analysis of a large number, 185 different studies. And then so since then, we know that we're in the midst of budgets in the unknown space. And so being able to maximize dollars is very, very important, a worthwhile strategy for the price. And there are a number of research articles and research studies being done more and more on web-based uses of SBIRT. And that's what ScreenU is. That's why we're going through this to set us up and to get into ScreenU. Mentioned previously, but SBIRT is supported by the World Health Organization. It is supported by SAMHSA, supported by the American Medical Association, the U.S. Preventative Service Task Force, and has been in the last several drug control strategies, within the White House administration. So it's been included in several of those. So we think about what, we think about why, thinking about where we can use SBIRT with the knowledge of what it is and why is that we literally can be used everywhere. With that concept of universal screening, it can be used universally. So thinking about the entire population of a college campus, but then it can also be used within specific populations. Thinking about, we see a large number of our members and users using ScreenU with fraternity and sorority life, trying to use it as well with athletics, getting that invitation in the door with athletics. So it can be used specifically with, we know, or high risk organizations or groups, but then it can also be used universally in settings where we know we have attention. So if somebody is checking in somewhere and we have the capacity, someone is in front of us, we have their attention, we have that capacity to give them a screening, whether it is paper, in person, or a web-based screening. So if we think about who would be utilizing, who we would be reaching with SBIRT and screening, other than everyone, we talked about the goal is to keep people from a greater risk. And so that is where we see the target population would be those folks at risky use. So keeping them there or having a lower risk, or moving them from risky use to lower no risk, or keeping people from moving into that risky use category. And then so we're not, as screening is not for, it's not a treatment tool. It is that primary tool. So keeping people from experiencing greater harms. So there are some challenges to in-person SBIRT that come up. While we know it is valuable, it has been researched and shown that it is a cost-effective strategy, but some of it is it requires training. So if you're going to do in-person SBIRT, you have to train folks on motivational interviewing. You have to train folks on the tool that you're using, the screening tool. For example, with ScreenU alcohol, we use the alcohol use disorder identification test. But it can also be time intensive. While quick, it still requires one-on-one meetings. You can only do so many of those during a day. And because of that time intensity, it can be hard to implement implement on a large scale, and it would then require manual data tracking. So if you're trying to kind of collect some data from those in-person meetings, you would have to then put those in manually. So if we think about how does SBIRT work, we get to a flow chart. I absolutely love flow charts. I will just give you a heads up. This is not the only one that we will see. So excited that we get multiple flow charts today. And so it works just like this. So a person begins, so they experience a screening. And then, so are they experiencing harms or high risk? And then, so no, not necessarily. So the health professional or the person doing the screening would reinforce positive behavior. Yes, if there is some risk, here the health professional would ask further questions to assess level of use. And so we would get in there, and so we think about high risk, severe use. And so if we know we're at the level to where treatment is needed, going further in the brief intervention in the in-person is not always valuable. So you would move right to the referral to treatment, but then we get in to that brief intervention here. And then within that, you can also do after brief intervention with the referral to treatment if it's looking more at resources and ways to stay connected and seeking potential care. So that is in person. So we've covered all of our bases in terms of questions. And so if we think about how SBIRT happens, one way and specifically that we offer at the center is ScreenU is a web-based version of SBIRT. And then so we have 3 specific programs for alcohol, cannabis, and prescription drugs. And then so you can see here that it's showing up on multiple devices. And so this is because we have learned from our members that students are wanting to take this on their own personal device, whether that be their phone, whether that be their iPad. And so ScreenU does adapt to the specific device that they are using. And then so if we think about how does ScreenU work in sense of SBIRT, I told you it was coming. And then so here is our second flow chart. And then so it looks a little different. It's not as complicated without that many steps, but a student then would take the screening. For them, it is a link. So they would click on the link. They would take it immediately after finishing. They would then get their feedback on their risk level, on their use, information about what is going on in their body. They would begin that intervention, that brief intervention, using motivational interviewing in a series of open-ended and scale-based questions. And then lastly, they would then get the resources that the campus is able to put in on the back end. And then so that are specific to the campus and the community. Okay. Whoop. So before we get in, really diving in to the demo of ScreenU, some things I want to point out, some benefits of ScreenU. So it is a web-based anonymous screening. It is a fully anonymous tool. I know for some folks that can be a drawback. We completely understand from when the tool was created. I think it was, how can we help campuses screen at a large level? And for the most of that, we decided anonymous was the best way for us to move forward. So it is a fully anonymous screening. It is brief. Each tool takes less than 10 minutes to complete. For campuses to implement, it does not require any training. It connects students with vital resources on campus, does give you an element of real-time reporting. So while it is anonymous, you do get overall aggregate data of students and the risk levels that the students are reporting from taking the screening. There are some customizable elements such as the resources and things of that regard. And there are 3 specific programs. Now, before we get ready to pop into the demo, if you would like to follow along, the first thing that we're going to do is we're going to take a student version of the screening. And then so this will take you to a landing page for ScreenU, and you can choose which of the 3 there that you would like. Anthony, I think, is going to be able to pop that bottom link. So if you don't want to scan the QR code, if you don't, I appreciate you. I love resistors, absolutely. And then so if you would love to bring up a ScreenU demo, please feel free to do that. And then so giving a couple minutes and seconds here. So give people time to pull that up. Let me go ahead. Oh, Anthony already put it in there. Boom, killing it. Didn't pop up for me. Like, show me a. Oh man, look at all these great people putting. I just didn't. It's not. Wasn't showing me that people had chatted. So I was like, oh man, nobody wants to talk today. You guys are crushing it, and I didn't even know. Apologies. It wasn't showing me that chats were happening. So sorry about that. Thank you so much for introducing yourselves and being interactive. I absolutely love it. Okay, so we are going to stop sharing for just a moment. And we are going to pull up a web browser. And so we're going to get right in to the demo. Okay. Anthony, if you cannot see the ScreenU page at this time, just stop me, and I'll just unless I hear from you, I will assume we're all seeing the correct thing here. So I mentioned it earlier. So it is a link. So when a student clicks on the link for ScreenU, it could also be a QR code. So if you could create that QR code on your own during tabling, if students are coming by, all they would have to do is scan the QR code. I mean, it would pull up automatically. It would pull up this link right here, and the student would be able to hop in and go through. So this welcome page here, this text, you have the ability to edit this text. It does have the formatting elements there. So if you need to provide links or put any information in, you can. And then it gets into our demographic questions. And I do want to let folks know we are in the process of working with our developer to make this gender identity question optional. We understand the realities of the moment, and we want to make ScreenU a tool that is usable for everyone, and that you don't have to not use a tool because of something that we can control. And then so while we think it is valuable information, we also understand the moment. And then so hopefully by the time fall rolls around, you would be able to click a toggle on and off button if you need to not collect the gender identity information. So we go through here. So I'll open this here so we can see all of the options that we do have available. In calendar year 2024, we launched, we launched new gender questions and gender options to be more inclusive. And then so to have a longer list, and we have a two-part question. So all students can answer with their preferred gender identity, and if they would prefer to answer and identify as trans, they have the option to do so. And then class rank is first year undergraduate all the way to graduate doctoral. Unfortunately, we do not have a way to add or edit those options. And then age is self-input. What we see here, so all three programs, and we're specifically gonna go through alcohol because that's what majority of screens of our members are using. And so all three programs have a gateway question of have you used the substance in a specific time frame. And so if a student selects no here, the screening is over. So they're going to get positive reinforcement on their decision not to use, and they still get the resources page that is specific to campus and the area. If a student selects this little checkbox here that they're in recovery, no matter if they select yes or no. If they clicked continue, the screening is also going to be over. They're going to get positive reinforcement for their decision to be in recovery. And then they are going to get a recovery specific resource page with, again, self input from the campus, but recovery specific resources that are available on campus in the community. And so if a student selects yes, then they begin the screening. And just some information on the screening tools that we use. So I mentioned it earlier in alcohol. What we're going to go through right now is the alcohol use disorder identification test from the World Health Organization. And then for cannabis, we use the cannabis use disorder identification test, also from the World Health Organization. And then we also, for prescription drug, we use a tool that was created in concert with the College of Pharmacy at Ohio State University, where we are housed. Apologies for seeming a bit distracted. I wanted to double check and make sure that we were covering any questions. So I was trying to make sure we have all of these. And then, so I did see one, and I just want to highlight before we go through the screening tool itself. This is what the students would see, because I think it's valuable. Who is, like, what type of student is ScreenU for? And ScreenU is for all students. And then so any type of student can do ScreenU. So it's not for students who have just had substance related outcomes or consequences. It could be for any and all students. And like universal screening, I think ideal for me is that how can we get ScreenU in front of every single student? Because we do have the opportunity in that beginning. If they select no in that gateway question, then they get some positive reinforcement on their decision not to use, but they also get the resources that are available because we know they're going to be around the substance at some point. And so it would be available there to them. And then so it could really be used for any. And as I mentioned previously, we have seen success with high risk groups. So specifically going into a fraternity or sorority chapter, having them take the screening in person and then pulling up their results in live time. But it doesn't just have to be done with risky groups. It can be done with any and all students. So we're going to go through this pretty quickly. We're going to go through it, try to answer at a moderate risk level, because that's where majority of our students that do consume are going to be. So we just have to make sure our math is correct today. So this first one is, how often do you have a drink containing alcohol? So we'll go 2 to 3 times a week. Question 2, how many standard drinks containing alcohol do you have on a typical day when you are drinking? And then so we will go 3 to 4 on that one. So question 3, how often do you have 5 or more drinks on any one occasion? So we'll answer less than monthly. And then question 4 is, how often in the last year have you found that you are not able to stop drinking once you started? So we'll answer on the low end, but less than monthly. Question 5, how often in the last year have you failed to do something that was normally expected of you because of your drinking? So we'll answer monthly. How often in the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session? How often during the last year have you had a feeling of guilt or remorse after drinking? So we'll answer monthly there. Question 8, how often in the last year have you been unable to remember what happened the night before because of your drinking? Question 9, have you or someone else been injured because of your drinking? So we'll answer no here. And question 10, has a relative, friend, doctor, or other healthcare worker or professional been concerned about your drinking or suggested that you cut down? So we'll answer no. And as soon as we hit continue, we get the feedback. So it is immediate, non-biased, because it is provided by the computer. So it has their risk level at the top. And then so information about what is going on with their body. So impaired judgment, diminished muscle coordination, not a losing the ability to concentrate. And then there's also some information about tolerance. So, what is going on in their body in relation to tolerance? And I just want to point out so, this is the specific feedback that is for um, moderate risk. So it is going to be different for low risk. It's going to be different for the first level of high risk, and then the level following that from higher risk. And so as the risk changes or goes up, it is more specific to that level of risk. So this information does change based on risk level. So immediately after going through um, the feedback, and then so they start the intervention. And then so I did see a question about getting a copy of the questions. Won't be able to provide that during the session from being able to pull it up, but Rachel, I can reach out and provide those to folks. But we're going to walk through them here, and the motivational interviewing questions that are used in ScreenU alcohol are also used in cannabis and the prescription drug one as well. So the intervention questions stay the same. And so we had an opportunity pre-COVID to go through and look at a large set of data from Ohio State with their permission. So just looking at a lot of the answers that students gave. And then so that we'll be using that experience to answer these open-ended questions. So this first one is, what are some reasons you've thought about changing your drinking? And so we saw students end up in two buckets here. So they would be in health or finances. And so if it would be finances, that I have been spending a lot of money on alcohol. And then there's a follow-up question to that, and the students stay in these same buckets. So if you did decide to change or stop drinking alcohol, what positive impacts might that have? And so we see students fall into that with health, that they say, I feel better, or I've lost some weight. But then in finances, we also see them say that I would be able to save money, or I would be able to do different things because I would have more money. Then we get into the change questions. And so a series of scale based and followed by some other open ended questions. So getting in importance, confidence, and readiness for change, and how a student answers here on the scale impacts the open ended questions they receive. So we're going to vary our responses just so we see the different options for response questions. And then so is, how important is it for you to make a change in your drinking right now? So we'll answer at a 4. So that middle point. It sounds like changing your alcohol use isn't important to you. Why did you choose a 4 and not a 2? So common response that we saw is that students kind of admitted is that sometimes I drank more than I intended, and had some consequences I didn't think of. So then a follow-up to that is, what would need to happen from you to go from a 4 to a 6. And what we saw in response for students can mostly be surmised is kind of that college effect, downplaying the impact and really just saying, something major would have to happen because it's just college. It's not a big downplaying the issue at this point. So then we get into the confidence question. That same scale, 0 to 10. How confident are you that you would succeed at reducing or stopping your drinking? So on this one, let's answer on the low end. So we'll go 2 rungs down. We'll answer a 2, and we'll see how those questions change. Okay, it sounds like you're not very confident right now. Tell me why you're a 2 and not a 0. And I always chuckle when I think about the day looking through these responses, because it felt like just in reading the responses, the students got a little defensive and they were just like, hey, now I still have some self control, just not very much. Um, And so that's what they were saying, is that, they still have some, but they easily lose um, that control. And then the follow-up question is, what is one barrier to change? And the most common theme by far was really what they were describing as being left out, or the fear of missing out. They want to be with their friends, and they want to be in those social environments. And unfortunately, those social environments involve alcohol. And then the last scale-based question is on readiness. How ready are you to make a change? And so on this one, we're going to go on the high end to see that. We haven't seen that yet. We're only going to get one open-ended question here, and it sounds like you're ready to make a change. What change? What would change look like for you? And students were pretty comprehensive here, talking about, if they did go out, one, they would need to go out less, but if they did, they would need to make a plan, and they would need to stick to it. Okay. Apologies for my slow typing today. So immediately after answering that last question, they get their resources. And again, this is resources that you input on the back end. So the campus inputs on the back end. And one thing to point out is that the risk level of each student is reiterated here at the top. And then so you can see that here. So we have had people asking this about counseling or in conduct. So if students are asked to take it beforehand, how is it possible to talk to them about their specific risk level if it's anonymous? If you ask them to bring that resource page, whether on their phone or print it out, you can have that conversation by knowing the risk level at the top of their resource page. And so resources that are input, again, we're just looking at a demo account. So this is just what they could look like, but you have the ability to put the name. And it is important to know that a name, that when it is inputted in the resource category, which we'll look at momentarily, the name that is given to it by the campus is what shows up on the resource page. And so if it's specific to the university, if it includes like the name of the university or the mascot, so it'll be specific that students know it. You have the ability to put in description. You have the ability to put in geographic information. You also have the ability to put in a phone number, email address, and web link. And I think these are extremely valuable. As I mentioned earlier, students have expressed interest in wanting to take this on their own device. So that means that these are links, they're clickable. So they can make a direct phone call from this, they can make a direct email, or they can visit the web page simply by just clicking it on their phone or their iPad. And so we'll look more at resources on the back end of the admin side. But as we continue to go through this, some protective factors that are important for students that are included in here as well. And any resource that does not populate at the top is going to be down here. And this resource page can be saved as a PDF, or it can also be emailed directly to the student in that PDF. So if they just put their email in here, it is not stored anywhere and it goes directly to them. And so this is what that resource page looks like. And so it is in web format first, and then at the very bottom, they are able to download that as a PDF. And let me open. And so this is what that would look like here. And then so same thing that we just saw, but in PDF format, so they can save it on their phone or leave it in their personal storage known as email. One thing to point out here before we get into a couple questions and the admin side of things, there is a certificate of completion. It does not have a spot to put a name. However, it does have the day that they completed it and the unique confirmation number. And then so if they need to turn this in for proof, or if they need to turn it in with their name for a class, I say a professor is able to do this for credit or extra credit, even this is a way that that could be done. And this could be downloaded as a PDF or sent directly to their email as a PDF as well. Okay, I want to pause because I saw we had a couple questions come in. One is a great question. It's about our students thoughtful in their response to the motivational interviewing questions. And the first answer is not all of them. That will be honest. And how one thing to point out is when we look at the reports, you actually have access to that in a raw data file. So you can go through and look at those responses. So this is not a scientific percentage answer, more so hypothesis looking at national data reports is about 80% of students who are participating in taking ScreenU and go through those motivational interviewing questions are answering it thoughtfully. So you will see some that are left blank or have silly answers or just have characters in there. But about 80% of students are answering them thoughtfully or in a way where they're actually thinking about the question. And to me, that is a positive number. So I wish we could say 100%, but unfortunately, there are some nefarious actors in there as well. Second question, let me read it briefly. Yeah, I had a question about walking through specific answers. So there is no way for them to print out their answers to the responses. Now, currently, in our the member portal that all members have access to, there is a section um, in there that includes all of the questions to ScreenU. So you could be able to walk through them. Like, do you remember taking this? How do you remember answering this question? But there is no way for them to print out their answers after the fact. Really great question. Okay. Remember, please continue to put in your questions so we can go through those. At this point, we're going to walk through the admin side of ScreenU. And so when you as an admin log in, this is the page that you would see. And then so you would get an activity feed that is updated in real time. And then so as students are taking the screenings, you would see how many. It would update there. Your data would update in real time. You would also see it against the national data. One caveat I do want to say about the national data is it is not a true generalizable data sample because every campus is using ScreenU a little bit differently. But it is a nice little snapshot that we see. So unfortunately, not a true set. But it is a good sample of campuses using ScreenU nationwide and all of the programs that you are using. So if you're just using alcohol, you would just see that cannabis would be there. So if you're using that program, it'll show up for you there. So ScreenU is navigated with the left-hand toolbar. And then so we just went through the student-facing side. What we did is we participated in a campaign. And then so every single ScreenU link is a campaign. And then so as a campus, you can have an unlimited number of campaigns going on at any one time. So I previously mentioned about campuses working with their fraternity and sorority chapters. And then so you can create a campaign. If you go into let's just say Alpha Alpha Alpha, for example, you would be able to create a campaign just for them. And then so you would be able to pull up their report in real time to look at their data. And then let's say the next night, you had another staff member go to beta because we don't need to be working every single night of the week. And then beta could have their own campaign as well. And so the main point trying to show there is you can have an unlimited number of campaigns. You can have ones that are for specific groups. You can have one that is generic for your website, or maybe you're working with a specific office on campus that they want to use it for check-in. And then so you can create one specific for them that they can then create a QR code for, and students, when they check in for their meeting or their appointment, they can take that there. So campaigns are vital to ScreenU, and Creating one is super simple. So it can be done by clicking on this create a campaign button here on the left, or clicking on the campaigns page, which will show you where all active campaigns are. So if you're wondering if you want to access a campaign after the fact, it's going to be on the campaigns page. You can also create a new campaign here by clicking on the create new button across from either alcohol, cannabis, or prescription drug. And then so you'll see in the top right that there are 5 little bubbles. And so there's 5 easy steps. So this first one is just going to be key information. And then so the we will have here is the name, excuse me. And then so what is important is to being as specific as possible as you create more campaigns. It would be hard to justify one from another, so we want to be specific in that. We do have the ability to change the name of a campaign. And then so one caveat we have, and this is from our developer, we get the feedback from members. They would love to be able to do this, but there is no way to delete a campaign. And then so our developer is very nervous about deleting data. So we do not have the ability to do that. But if there is a campaign you created but never collected data, you can go back in and edit and recycle that. And then so changing these fields. So every campaign is tied to one specific program, such as alcohol, cannabis, or prescription drug. When we look at the Manage Campus tab, we'll talk about departments. You have the ability to create departments within the ScreenU admin site. And as you add multiple users, let's say if you have someone from student conduct, you can then add them to that department, and when they create a campaign, they can then add that campaign to that department. And what that does is, as users are added, only users in certain departments can see campaigns that have been added to that department. So there's a little piece of continuity there. So we have that ability. Every campaign does have to have a start and end date. So let's say, for example, if we're putting a campaign on our website, we have the ability to go a few years in the future for that. And then so we don't, if we just want to leave it for the year, we can go into, not that I'm wishing away the summer, that makes me cry. But if we wanted to go into December 31st, 2025, we have the ability to do that. Step 2 is custom messaging. So that welcome message that we saw, that last message that we saw there before the resources, or the after the resources, that thank you message, we have the ability to edit and customize those. We have the formatting capabilities to add links as needed as well. Steps 3 and 4 are optional. They're known as the automatic email invitation feature. Now, there is no way to see a student's responses, but if we do want to track completion, we have the ability to do that using this step. So in step 3, this is that custom email that is going to be sent directly to them. You have the ability to edit this. We do want to leave in the text here in brackets because that's going to be our formatting. This here, the screening link in brackets, this is going to be a blue button in that email. And so it goes directly to them. If they click on that and then go through the screening, you will be able to see on the back end a list of students who completed that, and it'll have a timestamp showing their completion. Again, can't see their individual responses, but you can see their completion. And then step 4 is adding those names. Now, this can be done now, but it can also be done after the fact. So if we're doing this in student conduct, excuse me, my brain decided to stop working for a moment. And so then if you know, like we have a list here, but then you would be able to add that as needed throughout. I'll show you that in just a moment. So you can add them manually here with a comma in between, or if you know you're doing a large group. So let's say you're doing all incoming athletes, for example, you would just need a CSV file with names or email addresses, excuse me, in column A. That is it. And then there is a sample file you can download with this link right here. And then step 5 is a review. Everything that you've created, the name, making sure you have the right program, those dates, and then you get your links. Now, every single campaign comes with 2 links. It can be a little confusing, but demo URL doesn't collect any data. So if you're trying to build capacity on campus, or if you just want to check and make sure everything looks okay, demo URL is what you want to do. It doesn't collect any data. Campaign URL is live. This is what you want to put on websites, what you want to send out to students. And so this is the one that collects data, the campaign URL. So if we want to edit a campaign, we go back to our main campaigns page by clicking the campaigns button, and we want to click on the campaign that we want to edit. Here we have the ability to edit the name if needed. If we need to add it to a department after the fact. One caveat is you have to be a member of that department to add it to a department. So only departments that you were a member of is what's going to show up here. And then so if you need to edit the start and end date, so let's say you have it on the website, that day passes, and you're like, we didn't make any changes. We're just going to extend it another 6 months. You have the ability to do that. If you want to make edits to those custom messages, you can do that here. And then that automatic email invitation feature can be edited and updated with these 4 purple buttons. So you can add additional folks. If you want to check progress, that's going to be this top right button. If you want to send a reminder to those who have not completed it, it's going to be the bottom left, and that email template is going to be the bottom right button there. So as we transition to resources, I'm going to take a look at questions just briefly. Had a question about customizing demographic questions. Unfortunately, we don't have the ability to do that in the tool itself. However, there is opportunity to link to in the thank you message to link to a separate brief survey. So if you wanted to get more information from students, so you would have the ability to do that, but not directly in the program. Had another great question about how ways universities have used ScreenU. So we currently have about 60 campuses utilizing ScreenU, and we've seen it again mentioning working with specific fraternity and sorority chapters. We've seen campuses using it for mandated, so all students have to take it per year. Some campuses we've seen campuses have new students are having to take it. And then we are also seeing campuses use it in student conduct for those very low level or first time alcohol sanctions. We are seeing it done in tabling. The University of South Carolina, for example, has used it in outside the wellness center, excuse me, and they found a way to draw people in from that is giving away bananas. People leaving the wellness center apparently really love bananas. So Amy has been able to talk about the success rate of that. Take the screening, they can give you a banana. And then so we've seen it used in a myriad of ways. So that's just education and information sharing there. Ways that campuses have utilized the data is looking, actually the University of South Carolina was able to partner with their College of Public Health, and then so got some graduate students, and they were able to use the data in a project. And then so looking at some of the ways, looking at those open-ended questions, right? And so looking at the ways why some students didn't want to change or were nervous about change, and then using that information into resources or programming moving forward. So it's informing the work that you do, and it's also then helping students fulfill class requirements. Really great questions, everyone. Thank you. I know we're slowly running out of time. Resources, adding them is super simple. It is just including as much information as you want. And again, the name that you give it is what shows up on the resource page. And then so there is a resource type. This helps it populate on the page. And then adding a resource, you can do it all at once to any of the categories. So you don't have to type it in multiple times. We do have the geographic information and then have those important links that students can click on there. This is probably the most time intensive on the front end of getting it ready, is making sure all of these resources are there and uploaded. Okay, next one I want to look at is manage campus. This is mostly adding users. So adding a user is super simple. It is just clicking this add a user button and then adding in their email address and then deciding whether them to be a campus admin or user. Campus admins can add other people, whereas users can only operate in the departments that they are assigned. They can only create campaigns in those specific departments. And then you can, creating a department is super simple. So just adding that and then so if we create a new department, show you how to add to a department. So it shows up here. So we see the number of users. So if we want to manage, so we would then be able to click down as add users. We would be able to see all of the users that are in the program that are not in this department. And then the last thing I want to show is, we're running out of time. Apologies for going a little bit over, is on reports. And then so we have campus reports and compare reports. So in compare reports, you have the ability to compare two different campaign reports. And then within campus report, you are able to see the entirety of any single campaign. So when this report pulls up, unfortunately in this demo account, it's just pulling now from two campaigns. But if we were to use, like I've used the University of South Carolina, for example, they've been using the program for several years. So it would pull up from the entirety that they have been using the account. And then so from every single screening, they have the ability to put in date ranges for that. And then there also is the ability to look at reports from a specific campaign. So mentioning when working with fraternity and sorority life, and then so looking at a campaign specific report. Even in those, you have the ability to put in date ranges, but here's what this automatically generated report looks like. So those blips over time that we see, and then we see the students that were identified, so that received that custom email. Green is going to be completed, blue is going to be outstanding, and then we see our overall risk level here. And then with this pie chart, they start out being interactive. I'm not sure why it's not working. So this is supposed to show pie chart or a bar chart here that gives also information on the scale-based responses. You also get a chart for each of the demographic questions. And then every question in the screening tool gets its own pie chart as well. The last feature on reporting that I do want to point out is this purple button at the top about exporting CSV. This is where you have the opportunity to download that raw data file. So every single report is going to have this option to download that raw data, and that is where you can get those answers to those open-ended questions. Okay. A couple of things I just want to highlight before heading out. So if we continue on here, so if you are interested in learning more, don't hesitate to reach out to me. We could set up a live demo with yourself or anyone on your staff. Happy to set it up for multiple folks if needed. If you are interested in cost, so taking you back here, so the campus membership is the highest level. And so that includes access to all three ScreenU programs, which is ScreenU alcohol, cannabis, and prescription drugs. So that is $2,500 per year. And that starts independently. So we don't do a specific cycle. It's every single member is on their individual cycle. If you just wanted to do one ScreenU program, that is $1,000 per year. And so that's either, if you do two programs, it's 2,000, and then three is the 2,500. So it could be any combination of two programs. So 2,500 for all three, and then $1,000 for one of the single programs. So again, if you're interested in learning more, I know we're right at time. I apologize for going right to the bell. Don't hesitate to reach out to me, or if to learn more is the link there that Anthony shared earlier in the chat. So greatly appreciate your interest in learning more about ScreenU. So thanks so much for your time. I greatly appreciate it. And I will be reaching out with resources and more information about ScreenU, and hope to connect with many of you more soon. So thanks so much, everyone. Hope you have a wonderful rest of your day and week, and take care.